Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the neurocysticercosis, it is caused by cysticercus cellulose. And now, the diagnosis of neurocysticercosis. Diagnosis of neurocysticercosis is mainly done by an MRI or by a CT scan can be used to diagnose the neurocysticercosis. Mainly in the non-contrast CT scan, we can see that in patients with neurocysticercosis, parenchymal brain calcifications are more commonly seen in a patient with neurocysticercosis. And then in a patient with neurocysticercosis, the most common site of neurocysticercosis, if it is asked, the most common site of neurocysticercosis is brain parenchyma is the most common site. Then if you were asked what is the second most common site of neurocysticercosis, the second most common site of neurocysticercosis is actually a ventricular system. So if you see the most common sites, first it is parenchyma, brain parenchyma, followed by interventricular system, followed by subarachnoid system, followed by spinal system, followed by orbital system. So all these, so first it affects the brain parenchyma, followed by interventricular, followed by subarachnoid, followed by orbital are the sites of neurocysticercosis. Fine. In the neurocysticercosis, you will see that cysts are present in the brain. Are they present only in the brain? No. They are present in other sites also. So if you see the location of cysts in different organs, so location of cysts in different organs. Cysts are more common in CNS, thus the neurological manifestations of the neurocysticercosis are more common, and cysts followed by cysts may be present in subcutaneous tissue. They are present in striated muscle and they are also present in globe of eye also.
thank you and thank you for watching.